Hi everybody! Today, we're diving into clinical situations and instrumentation. We're going to cover the types of instruments we use, their specific purposes, and some essential clinical insights. So, buckle up, and let's get started. First up, let's talk about instrumentation. This includes explorers, curettes, sickle scalers, and ultrasonics like the cavitron and piezo. It's important to understand the parts of these instruments. The handle is where you hold the instrument, the shank is near the tip, and the working end is the actual tip of the instrument. Each part plays a crucial role in ensuring precision and efficiency. Explorers are a fundamental tool in dental hygiene, helping through tactile sensitivity. They have flexible shanks and a circular cross-section. The dental mirror is another essential tool used for retraction, indirect illumination, and transillumination. For assessing tooth anatomy and detecting calculus, the 11 to 12 Explorer is your go-to instrument. You choose the correct working end by sliding it between the teeth. It should wrap distally but not mesially. On the other hand, the 23 to 17 Explorer is used mainly for caries detection in pits and grooves, and to assess sealant retention and examine restoration margins. The 17 end is particularly useful for subgingival assessment of anterior root surfaces. When it comes to cleaning, we use sickle scalers and curettes. Sickle scalers are for supragingival use only. They have a pointed back, triangular cross-section, 2 cutting edges per working end, and a pointed tip. Examples include the C5, H5, and 204S. The C5 has a hoe end for stain removal, and a larger working end compared to the H5, which is used primarily on anterior teeth for supragingival cleaning. Curettes are designed for both crowns and roots. They have a rounded back and toe, and a semicircular cross-section. There are 2 types, the Columbia curettes and the Gracie curettes. Columbia curettes are universal and require manual angulation. They are great for heavy calculus removal and can be used on all teeth. In contrast, Gracie curettes are area-specific and self-angulated with one lower cutting edge. Different Gracie curettes are used for different teeth and surfaces. For example, the Gracie 1 to 2 is used on anterior teeth, while the Gracie 13 to 14 is for the distal surfaces of posterior teeth. Now, let's talk about clock positions for a right-handed clinician, ranging from 8 o'clock to 12 o'clock. At 8 to 9 o'clock, you focus on anterior surfaces toward you and posterior surfaces toward you. From 10 to 11 o'clock, it's for posterior surfaces away from you, and at 12 o'clock, you handle anterior surfaces away from you. Ultrasonics, such as the cavitron and piezo, use acoustic streaming to disrupt the cell walls of bacteria, effectively killing microorganisms through cavitation. However, these are contraindicated in patients with respiratory diseases, like COPD and asthma, those who are immunocompromised, or those with communicable diseases like TB. They are also not suitable for patients with a strong gag reflex, porcelain restorations, demineralized areas, sensitive roots, or new teeth. The cavitron has metal stacks that convert electricity to movement, producing heat, hence the need for water. The piezo, on the other hand, uses ceramic discs, is less warm, and requires less water. Each has its specific uses and handling techniques. For example, with the cavitron, the point has the highest power, followed by the face, back, and sides. With the piezo, both sides of the tip are active. For proper maintenance and use, flush the water tubing on the cavitron for at least 2 minutes at the beginning of the day and 30 seconds between patients. Fill the handpiece with water, lubricate the O-ring with water, insert the tip, adjust the water spray, and manage the handpiece cord. Always use a pre-procedural rinse to reduce bacteria in aerosols, position the patient correctly, and ensure efficient suction. Periodontal health is crucial and should be achieved in the least invasive and most cost-effective manner. This involves thorough periodontal debridement and root planing to remove subgingival plaque, calculus, and root surface toxins, while preserving tooth surfaces. Oral irrigation with water or antimicrobial agents can further help in maintaining periodontal health. Lastly, remember that implants require special care. Avoid using metal instruments on them, and although probing around implants is recommended, it is not for measuring probing depths as with natural teeth, but rather to check for signs of implant failure such as pus or excessive bleeding. That wraps up our overview of clinical situations and instrumentation. Keep these tips in mind, practice regularly, and you'll master these techniques in no time. Happy studying, everyone!